Hello, I'm Gerard Versmede, co-founder and CEO of Unifix Care. And with Unifix Care, we develop quality tests to help hospitals and governments select the right surgical instruments for their surgeries. What's interesting for this experience, of course, very often we're in the Netherlands talking about problems, how we see it being in Kenyan hospitals. And now being in Kenya with key players in the Kenyan market, government, but also private and financiers, really helps us to gain these insights and implement that into our strategy. The next steps we've built the connections specifically with certain organizations that now we need to follow up. We need to really make sure that our offering and their needs really align so we can really take it to the next step. And I believe I've scheduled a couple more days in Kenya to really iron that out and go to the next step.
My name is Katra Ali. I'm the Director for Health at the Council of Governors. We do a lot of coordination in terms of all health matters, in terms of emerging issues in health, and we also provide technical advice to the governors. We do a lot of coordination between the two levels of government. For example, if national governments want to seek support, or if there is a training, or if there is any communication they want to do to counties, they basically come through the Council of Governors. We are also a platform to coordinate between the development partners and the counties. If a partner wants to engage with us, they usually do a courtesy call, and we basically tell them more about Council of Governors. Specifically on health sector, let me just say that health is a devolved function. So the partners that are actually in health space actually come through us to see how they can get an entry point to the county. Probably they have a program that they want to run, or probably they have something they want to do within the counties and they want that coordination.
My name is Dr. Noel Orata. I'm part of the Open Phences team as the ecosystem design lead. And I am part of the team leading this project in collaboration with the Embassy of the Netherlands Enterprise Agency and Task Force Healthcare, looking into how we can facilitate Dutch businesses to come and do business here in Kenya. So we look at healthcare as this big ecosystem where we have the public players, the private players, and even in the two, we look at the WHO building blocks. We look at it as a big ecosystem approach. Healthcare alone intersects with other sectors as well. Even as we're thinking about partners and all this work we're doing, we're thinking about what are the key things in healthcare, but what are the supporting instruments that allow healthcare to run smoothly?
I'm Dr. Gregory Ganda. I'm the County Executive Committee member, basically the Minister for Health in Kisumu County. I head the Department of Health. Private-public partnerships and collaborations are very important in government because they inject a new blood into government. So these engagements come in so that we talk to each other, you understand each other's needs, and be able to co-create so that you come up with something that works for all of you. Then we come up with a common document where each of us has their roles. And that's how you can be able to achieve efficiency and actually the desired outcomes that you want.
My name is Dr. Wanjiro Mwaniki, and I'm the project manager for the Combi track in life sciences and health in Kenya. We needed to bring both the public sector and the private sector, including faith-based organizations, into the mix. First, to understand the landscape in Kisumu and Homa Bay, then also understand the Dutch solutions and how they fit into those prioritized needs in healthcare. The biggest return on investment that we can have for our children is when we invest in them from the time of conception. We can all follow this path and ensure that the first 1,000 days of life are well taken care of for our children.
My name is Grace Masio-Sewe. I am the County Executive Committee member for Public Health and Medical Services in Homa Bay County. A public-private collaboration gives us an opportunity to apply some things that the private sector does very well. It also brings resources that we don't have as a public sector. Then we'll be very systematic in identifying specific areas that the different partners can support.